1-800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752 right here at the station. You can speak directly with Dr. Darrow yourself about your chronic pain issues. We're here Saturdays at 10, again at 1 p.m. The website is www.lastemcells.com, and right now we're speaking with Jack.
Hey, Jack, Dr. Marc Darrow will pick up in just a second. I wanted to mention a couple things. If anyone calls into the show right now, I'm giving out a copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, for free. It's got an introduction by Suzanne Summers, one of my favorite people on the planet. She loves getting the message out to help doctors help their patients. And I've been working with her for many years and her family. And thank you, Suzanne Summers. God bless you. This is a great book. It's got 200 or so pages of information on why you shouldn't be getting surgery for orthopedics, the side effects of that, and how easy it is to get injections of regenerative medicine using your own cells. You can use your platelets or your stem cells to actually heal the areas in orthopedic injuries. Doesn't work for everything. Don't think it's a magic thing. It just works when you do it, meaning you've got to stick to the program. Too many of my patients cheat on me. They don't do what I tell them to do, and they come back and go, it didn't work. Well, you got to work it too. You got to do your part of it. And a lot of that means letting it heal, and don't go out being an exercise fanatic after you get an injection. You've got to let things heal. It took years for a lot of people to get where they're at with these arthritis type things, and sometimes these long-term injuries that don't go away. Don't expect an overnight success. I've had that happen to me, luckily. I've had overnight success with healings on my body that I've self-injected, and that led me to become a regenerative medicine doctor. But I always tell people to be patient. It takes sometimes weeks for things to heal, and sometimes several treatments. So come in with the proper expectations. We discuss all that. I spend a lot of time with my patients. Every patient gets my cell phone number and my email, my personal email, so I stay close in touch. So, Jack, your daughter has a knee problem. How old is she, by the way?
Hey, Doug, good morning.
Jack,
how you doing? Hey,
yeah, Jack, how old is your daughter?
32.
Okay. And how did she injure her knee? What happened?
Well, she's always had a bad knee, but this last time she fell off her bike, so I think she really made it worse.
Okay. When you say she always had it, I mean, did she have it as a little girl, too?
She would always just complain like it would pop out like something was wrong. Yeah, you know.
Okay.
And I think when she fell off the bike, I think that's when it hit its peak. It was probably about a month ago, and so she did go to the doctor. She has she went to her healthcare provider, and it's a pretty big word I use, a healthcare provider. But anyway, so she went to the doctor, and they told her that they did an MRI, and they said she has a MCL, an ACL, and then also the the lateral meniscus, all tears. So I was going to go in there myself, but I chickened out. But I told her about you, so I guess I told her, I said, well, you know what? They want to have 2 surgeries. That's basically what they told her. They said it's going to be 2 surgeries. So I told her, you know what? It might be some hope. I said, that's what dads are here for. Look out for their baby girls. And I said, hey, let me call Dr. Darrow for you. I'll come on Saturday and just ask him. Is that anything you think you can do to help her on that, or does she should just, with all those tears, does she just go do the surgery?
Well, generally we can help, but I can't tell her or you until I actually touch the area with my hands and move the knee around, see if it's loose or not. Most ACL ruptures, ACL is anterior cruciate ligament. Most of those do not have to be operated on. And there's a lot of pro athletes that don't have ACLs that play football and baseball, and they do just fine. It all depends. I see some that are very loose. The knee is very loose, and there's a couple of different tests that I'd perform on her to, exam test to see how tight the knee is. If it's not tight, she has a problem. If it is tight, she basically has no problem, and it just takes a while. The studies show that if you decide to get an ACL surgery, you should wait at least 3 months after the injury for the knee to quiet down. The results come out better. But most of my patients who have ACL tears, and I'm talking about high-level athletes, surfers and you name it, don't need to get an ACL replacement surgery. So I have to touch her on the knee and stretch it and see what's going on. And the MCL and the LCL, those are medial collateral ligaments and lateral collateral ligaments, usually heal up very, very simply. Okay? So unless her knee is wobbling around, we can probably help her using platelets from her blood or stem cells. Okay?
Oh, I see. Yeah, because, she's walking around with a brace. She just has that, she's got, you could tell she's favoring it. And, but like I said, 2 surgeries compared to maybe something which you could help out with. I know that's what all the athletes, and you hear all this great stuff about it. I told her, well, it's worth to give it a shot to have you, put your hands on it and, give your advice on it. So,
it's definitely worth it for me to do an examination at least. And then we can talk and figure out.
Yeah, then we'll be in there. We'll be in there. We'll see you soon. Her name's Chantal, so you'll be. Then she could bring it up at the conversation we had, right?
Okay, beautiful. The other thing that you mentioned is that her knee is what you said popped out for a long time since she's young, and that's a type of laxity or looseness of the patella, the round bone in the front of the knee. And what we do with that is we inject all around the patella to thicken up what we call the retinaculum. It's like a glove that fits around the top of the patella and the knee to hold that in place. Okay?
Oh,
so
okay.
That patella, when you bend your knee, it slides on the femur in a place called the trochlear groove. And we can definitely tighten that up. I've had so many people that have a loose patella, and we can help thicken up the retinaculum and keep that from what we call subluxing, meaning a little bit of a dislocation or a complete dislocation.
Oh, okay, great,
right? Yeah. So there's good hope ahead for your daughter, Jack.
Yeah, I can't. That's promising news, and like I said, 1 surgery is bad, 2 surgeries, oh my goodness, that means I don't have to be running all the errands for her, you know what I'm saying? So if we get her in there, man, I'll do some magic, man, and then definitely hear what you have to say. Okay, appreciate it, Doc.
Yeah, it's pretty seductive for these kids to want to have surgery because all their friends have had, especially if they're athletes, and I get that same kind of thing with my daughters who are athletes. They go, the doctor says I need surgery, and I go, no way, you're not going to do it. And then we do PRP or whatever on them, and so far they're good.
Well, yeah, heck yeah. Have a dad like you, man, you could shoot them up at the breakfast table right there,
I have done it at home, I'm not going to lie.
Hey, Daddy, my ear hurts. Here, come here, let me see that ear roll right here. Bang. Yeah, you know what I'm saying? Yeah, But all right, Doc. I appreciate that, man. Like I say, we'll definitely be in there. I'll probably go in there with her, and I'll bring you a couple.
Yeah, come on in. I'd love to meet you, Jack. You're a great guy. Thank you so much for calling.
Okay.
Thank you,
God
Jack.
bless you and your daughter.
Okay, bye, Nita.
Bye. Thanks, Jack. Okay.
Let me say one thing before
Sure.
you take off here, Anita.
Okay.
With an ACL tear, we often see a lot of bleeding and swelling in the knee. And the first thing I like to do with that, as soon as it happens, is to aspirate the knee. That means to put numb it up so it doesn't hurt, and put a needle in there and take the blood out. And sometimes I'll get a giant amount of blood out, and the person is just relieved instantly and can walk almost instantly again. And I use an ultrasound inside the joints like that on the knees, shoulders, hips, whatever, to actually see where that fluid is. If you have someone who's going without an ultrasound and putting a needle in you, especially like on a knee, they're going to probably be scraping the cartilage off, and it hurts like heck. So the best way to do it is numb it up and use the ultrasound, see where the fluid is. We can get every single drop out, and it gives a lot of relief, especially if it's blood, because if you don't take that blood out right away, you're going to end up with a hematoma, which is like a big blood clot inside the knee. I've taken those out, pretty much everywhere around the body. Sometimes I get hockey players that fall on their, we'll call it the hip. It's not really the hip, it's the greater trochanter, and they have giant fluid collections. We have one wonderful woman who takes care of horses, and her horse kicked her right there, and she came in, and I drained out an immense amount of blood, and she had immediate healing starting to take place. So if you're going to get injections, go to a doc who uses an ultrasound so he can look inside the body and see where the pain is coming from and what the problem is. So I'm going to give out the phone number. Write it down. We'd love to get some callers right now. I'd love to talk to you. And the phone number to the studio right now is 866-870-5752, 866-870-5752. For those of you that want to call the office directly, that number is 800-300-9300. I'll repeat it while you're scribbling, 800-300-9300. And for those of you that want to watch me doing these injections, my website has a lot of videos and a lot of information about healing, which is www.lastemcells.com, www.lastemcells.com. Every single page has a spot to email me. A couple other things I want to talk about here is we do something called the vampire facelift, where we inject the same cells that I use on the body for orthopedic problems and arthritis. We can put that into the face with a teeny-weeny needle and grow back the collagen and make people look younger. By the next morning, people look great. It's an amazing procedure. Also, we can do that on the head to grow back hair. If your hair is thinning, what we do is we inject platelets or stem cells onto the head, and we do quite a bit of that to regrow hair. The patients love it. We also, if you have a problem with your hair, we check your hormones and make sure that your hair loss is not coming from things like hypothyroidism or low iron or hormone imbalance. So we can check all of that also. Boy, we got a bunch of calls coming up here.
We do. Very exciting.
Let's see who this is.
Well, as soon as they get racked up, we'll grab one of them.
Okay. In the meantime, why don't I just take a call, a question. Well, actually, we have Rick here with a hip issue from Seal Beach. Rick, can you hear me?
Well, this is Rick. How you doing?
I'm living it up, Rick. How about you?
Good. Here's my issue. I have a hip osteoarthritis with a cam impingement. I used the VA for my medical, and then an orthopedic surgeon said the cam impingement is probably causing the most pain, but my pain level is minimal. So I know you do PRP and stem cells. And
that's
since
exactly
my pain level is minimum.
Okay.
I don't want to have a hip replacement for a couple of years. I'm 74.
Okay.
The doctor says my hips are in good shape. I could have a hip replacement with no bone problems. Is there a difference in? I want to postpone or eliminate the hip replacement. Now, does PRP? How does PRP differ from stem cells in regrowing cartilage or reducing cartilage loss? Is there any difference in the two?
Yeah, I mean the way I talk about this analogy to patients all the time. If you have a hole in your backyard and you got to fill it with dirt, would you rather have one shovel or two?
Two.
Two. And it's the same thing with regrowing tissue. The platelets stimulate tissue to grow, and the stem cells are thought to actually create colonies of tissue also. So we mix them together, all right? We get both, and then the healing is much more complete and quicker. So theoretically, fewer treatments. You don't have much going on with your hip, Rick. I hate to say it, but you're a great candidate for this. You have minimal pain. What do you care what your doctor says about a hip replacement? You're not going to do it.
My pain level is medium to low, so
Yeah.
I heard
You're not going to get a hip replacement. You get a hip replacement, your pain level may go up to high, and you can have a leg length discrepancy and end up with back pain and hip pain. So I know you're not going to get a hip replacement. You sound like you're a fired up guy. You're probably an athlete. You live at Seal Beach. You probably surf. And
I don't surf. I can't surf anymore. I can't run anymore.
Okay, but you're a surfer, dude. Yeah. And surfers get a lot of hip pain just from stretching out the joint capsule sitting on a surfboard. It's very common. That's not a reason to get a hip replacement. I'm sorry. And there's a very high probability.
My X-ray of my cartilage a year and a half ago versus 6 months ago, the cartilage was reduced by half. This is my femur and my ball and socket reduced by a half in a year. So eventually I'll need a hip replacement. But the question is, there's a difference in PRP and or stem cells in helping reduce the cartilage loss. Is there?
Okay. Yeah, I just answered that. I just answered that question.
Is there any difference in the two?
I just answered that question, and the answer is you want to do both if you've got arthritis. Not one or the other. You want to do them both together. They both do different things, but they're both about
stem cells from the fat or the bone marrow.
I don't do fat anymore. People don't like it. Bone marrow is the easiest way to do it. Once the area is numb with a shot of lidocaine, it takes me about 15 seconds to do the procedure to get the bone marrow out. And I want to tell you one more. Rick, let me talk for a second, okay? I know you're excited. The other thing is this. You can't really check two different x-rays next to each other to say that half of the cartilage left in 1 year. That is not accurate. And the reason for that is you can do x-rays from different angles of a joint, and one of them will show no cartilage loss, and one of them will show complete cartilage loss. It's just the angle that it's done. And if you bring in both of your x-rays, I'm going to show that to you, okay? And I wouldn't trust the x-rays and I wouldn't trust the MRIs. The MRIs are overly sensitive. They show things that show up that are not real. There's all kinds of studies that prove that.
He bent my leg like you do. Said, here's why you have cam impingement. The cam impingement is more of a problem than the arthritis loss, or cartilage loss. In your analysis, you can determine if the cam impingement is more prevalent than the arthritis cartilage loss, right?
You know, you're making me laugh, Rick, because I don't believe in any of these things. And I have a big problem educating people that the diagnosis doesn't mean much. I heard you say you've got minimal pain, and if you've got some range of motion at all, we can probably get you better. So I always say to people, do you want to have perfection from the orthopedic surgeon point of view, or do you want to feel good? And people always say, well, I want to feel good. So lose the diagnosis, man. Lose it right now. Those diagnoses are usually wrong. The diagnosis.
You can see on the X-ray the cam impingement.
You bring them in, and I'll go over it with you. I promise. Okay?
Okay, very good. Okay.
The X-ray means nothing to me. Zero. Okay. You mean something to me. I don't work on an X-ray. I work on a person. I don't work on an MRI. I work on a person. And people come in with failed surgeries almost every single day. And I say, did the surgeon touch your body? Did they do an exam? Guess what their answer is?
Probably no.
No. I I'm not saying that's every surgeon, but most surgeons operate based on an imaging study. That's not the way to do medicine in my book.
Okay, so even though the doctor sat there and bent my hip, said this is why you have a cam impingement, because you couldn't bend your hip. The right hip is the one with the cam impingement. The left hip is normal. The right hip, you couldn't.
Rick, I've heard your story a few times already. You come into the office with your X-rays or whatever you have. I will spend a lot of time explaining all this to you. You're not getting it yet. Okay?
I understand.
And we have a lot of other callers here.
Thank you, Rick. Appreciate your call.
Rick, I love you and God bless you. I hope to see you. The number to the office, if you want to call it, is 800-300-9300. And we've only got 5 minutes here, but if we get a couple other callers, that would be good also. We're going to take what we got on the board.
Okay.
But the number here is 866-870-5752. We're going to go to Tom, who's got a knee problem. Tom, how are you?
I already picked up Tyus. I'm sorry.
Well, we'll get to Ty. Is it Tyus or Tius?
Tyus.
Tyus, okay.
Yes.
Tyus, what's going on with your back?
Hello, Dr. Darrow.
Yeah.
Hello, Dr. Darrow.
Yes, sir.
Yes, God bless you, and I love you.
Thank you. I love you, too.
Yes.
How long has your back hurt you for?
Well, it's chronic. It's sciatica. It's arthritis.
Okay.
I have an injury in my upper back, which I got in 79.
Okay.
That hurt. And that's
Tyus, I'm gonna have you hold for a minute. I'm gonna answer some of this before you get going here. I need to touch your back to see what's going on, and I can tell you in a minute. We're going to take him off of the radio, Nita, and
Gotcha.
we'll have him. So, Tyus, you can listen to this. Most back pain comes from the ligaments that are sprained. There's a lot of collagen ligaments that hold the bones together. And most back pain comes from sprains of the ligaments. They're not sexy and they're not sensual, and you don't need surgery for it. We can heal most of that using your own cells, which is a form of medicine called regenerative medicine, by thickening up the attachments to the bones, which is called the enthesis. We can heal most back pain, not all of it, obviously. But I need to touch the back, Tyus, and see where your pain is coming from to let you know if I can help you. So I want to go to Tom before the end of the show here. Tom, you've got a knee problem. How long has your knee bothered you for?
Hello, doctor?
Yes, sir.
Doctor, can you hear me?
Oh, yeah.
Yeah. I just wanted to reiterate to you about what you said about the ACL and PCL.
Okay.
I'm 80 years old now, but I was 70 years old when I tore both my ACL.
Okay. I'm so sorry, Tom. We are totally out of time, but go to the website, www.lastemcells.com. Thank you, Dr. Darrow. Thank you, Alex. Thank you, Suzette. Remember to tune into the Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. I'm your host, Nita Valens. We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.